too. And of course, time is money. And that's where that problem lies. How much is fair compensation for your time and efforts? I would put it even in the so-called public sector. Okay? Nowadays, there's an effort to make sure that we're trying to recover costs for whatever hospital that you're in anyway. And it begs the question, is more necessarily better? Okay, not just Singlish, more better, but we want to understand, how much is it that we need to put in? And I don't think there's a figure that we can actually put in, because it is all rather subjective, isn't it? In terms of how and when we decide we've done a sufficiently good job, to the point where we can actually sit down, analyze, and come up with that psychiatric report, that brief that we've been given. Now, here are some of the problems. Formatting came out a little bit wrong, but I think I'd like to highlight a few here. For example, the temptation to sometimes omit or distort data, or to suppress disconfirming data as we try to put forth our opinions, right? Or I've occasionally seen the use of idiosyncratic psychiatric diagnoses and theories in order to try and support an opinion. Allowing attorneys to change or even to massage your expert opinion. Or failure to address some concerns about conflicts of interest at times. I've seen also, embarrassingly, for sometimes my other colleagues, where cut and paste mistakes have been pointed out in court. So, the dangers of cut and paste can sometimes be quite telling. And I've already said that we should try and stick to that body of knowledge, that scientific method, if you will, using specific diagnoses, right? Rather than tentative general diagnoses. But even then, when it comes to access to, right, it's a rather difficult, controversial area. We've had people who will just hunt down an NMPI and see what you get. And although we've been talking about training, I'd like to say something about, if the only tool you know is a hammer, every problem looks like a nail. So sometimes one of the flaws about going for like the PTSD expert or like the bipolar expert, I would put it to you that sometimes too subspecialized may lead you down a rather tunnel visioned kind of situation. And so I think it all boils down to how much we hold to our ethical standards, our integrity, how much we're committed to this whole process of truth and helping the cause. And so the reminder is that we need to be objective. So we need to beware the potential sources of bias that we have. We're all humans after all. And the dual agency part has often been, and I'll say a little bit about that. And I think my own self-reflection is that there needs to be a fair amount of self-awareness ourselves. So when we're called to, on one hand, judge a mental state, but face it, when we're framing an opinion, we've got to be judgmental. But how do we balance that? I like this slide that supposedly tries to illustrate the problems of objectivity. Notice that the laws of physics are all employed, but depending on which perspective that you take, it can potentially draw a very different picture, which is one of the problems of the system that we have, the adversarial system that we have. So no matter how much you want to put forth your case, I think do not selectively edit, for example. So the double agency problem arises because, and these are the various divided agencies, right? We've got, on one hand, our doctoring mission to be the agent of our patient, our client, and family. And occasionally, you will be asked to actually give an opinion about a patient that you're treating. I find this a bit strange. Usually in courts, in the United States, for example, and the UK, that's usually not what they would usually ask for from the treating physician. But if you are called upon to do that and you have a treatment relationship, I would just say that you must make that extremely clear. And for yourself to question whether it may potentially bias. Then of course we've got lawyers, and I've had the pleasure and displeasure of dealing with a whole range of lawyers. Right? We have very different ideas. If you think doctors have different practices, lawyers have even a wider range, in my humble opinion. And then, we've of course got the, duty to the court, to society, and ourselves, and our own needs. So the ethical problems and conflicts come about because, first of all, it's the product of the adversarial system. Just because we're having two sides trying to focus on the relative merits or demerits of the case, sometimes if we feel that we are retained by one side, no matter how much we sumpah at the end, I think it's easy, I humbly submit, that we can sometimes be caught up with this partiality and increased objectivity problem. I think as far as the hired gun problem is concerned, I think the fee part is something that, at least the way I resolve it, is that I have a figure which I consider my consultation time, and I will charge according to the time that I have spent. We do not do, for example, if I win, you get how much, don't lose, then maybe we have a bit less kind of thing, right? That's when we get into moral sympathy ground, right? And then the confidentiality part, because clients sometimes believe that they're being helped, and we sometimes really need to remind them that there's certain limits to which we have patient privacy, and indeed for most forensic assessments, we have to tell them that we have to include potentially anything that they tell us in the report. And when we function both as therapists and experts, I think, at least in my view for myself, I think it would potentially impact upon my ability to be objective. So we've had some mention about from Nicholas about how we should ideally deal with lawyers. Not all lawyers, unfortunately, are as good in terms of giving you the detailed brief and instruction. There are others who will ask for a draft from you and helpfully try to help you edit. And then I kind of scratch my head and say, did I say that? So there are people who try to get away with that. So here we are in our moral quandary, and as I've mentioned, when it comes to the doctor-patient relationship, it's different when it comes to a psychiatric assessment. There's raw IMH. Now, is IMH the best place for a psychiatric assessment? Well, so one potential advantage is that it's a place where you can have a multidisciplinary kind of setting. You've got social workers, you've got your psychologists all in-house, right? And you have these things called grand ward rounds and so forth, which us humble psychiatric private practice fellows do not have advantage of. And so there is some value to that, certainly, definitely. And though we're looking for impartial people, right, there is danger, however, in groupthink, that you look for impartial people who think the way you do. And in the same way that we may have all these biases for, we believe the critics for our client who pays us, I think in the same way, it is important, I think I've said at both sides of the fence, so it's important also for the IMH psychiatrists sometimes to also question how much they need to be objective when there are some pressures from elsewhere as well. So the adversarial system in